in this case the regulatory dendritic cells, they can prevent the immune response. How? By producing IL-10, TGF-beta. And here is just an example that the antigen was captured by this 103 positive regulatory dendritic cell, and then it presented it to the T cell, converted that T cell into FOXP3, which is a T regulatory cell, and then it will produce IL-10 and TGF-beta and stop the immune response. So again, the question, I think now you know the answer to this. Why do food or commensal bacteria promote mucosal tolerance rather than an immune response? Why do you think it happens? Very good, regulatory dendritic cells, and then the cytokines IL-10 and TGF-beta. So here it's showing that there is a weak co-stimulatory signal, IL-10 is produced and regulatory T cells are produced. While, just to give you a comparison, in the immune response what's happening, there is full signal, there is first signal, and B7, CD28 co-stimulatory signal is there, and CD40 ligand is there. So as a result, TH1, TH17 or TH2 can be produced. Yeah, one important thing I just forgot to mention about the epithelium. I told you that the epithelium has to stay intact. Okay, if it's broken, there are maximum chances that the active immune response to pathogen will be activated. But other than that, the epithelium has got one more specialized feature. Normally, the PRR, pathogen recognition receptors, where they are present? On the cell surface, in the cytoplasm, on the nucleus, everywhere. But all the epithelium of the GI tract, they are only present on two specialized parts. They are not present on the luminal surface. So the luminal surface will not have TLR or nod-like receptors. They are both called as PRR. Where they are present? On the lateral surface, here, and the basal surface. Can you imagine why? So if there is another epithelium here, why do you think they are on the lateral surface and the basal surface but not on the luminal surface? Yes, so when the bacteria will, when the commensal bacteria are here, it won't respond. But when bad pathogenic bacteria will try to invade, these receptors will bind to it. So this is again to keep a balance. Intact epithelium will not be activated. How do the mucosal immune system ensure peaceful coexistence between the commensal bacteria and the host? So apart from the effector dendritic cell, regulatory dendritic cell and the immune cytokines, there are certain other things, like for example the goblet cells, they are capable of producing mucin-like glycoproteins. The Paneth cells are capable of producing antimicrobial proteins. So they also help together with the regulatory T cells and IL-10 and IL-4. And IgA will just neutralize the toxins and the pathogenic bacteria, and they will not be able to invade the epithelium. Now the question arises, we talked about all the organization of the mucosal immune cells, where they are present, how they recognize the pathogen. Now the question is, if there is a problem with this organization, if one of the cells is not functioning properly, then of course what's going to happen? There will be inflammation, there will be a disease. And we'll just see some of them. So you can see that the lumen has got, intestinal lumen has got pathogens, the commensal bacteria, and on the other side there is a possibility of regulatory component and there is a possibility of a inflammatory cells, Th17, Th1 and Th1. There is a balance between them based on what pathogens are coming. But if there is a problem with these receptors, which some of the people have, so for example, the people suffering from inflammatory bowel disease, IBD, if your question is why they are suffering from it, so there are certain answers, like there either is a problem with the host gene or there are certain problems with the environmental factors. So what is one bad consequence of using irrational antibiotics? It can kill your normal commensals, and it will give chance for the pathogenic bacteria to take over. They will invade and go inside. Then another thing is, if there is a problem with these genes, for example, NOD gene is basically for the this one, the NLR. This receptor is produced by this particular gene. So if there is a problem in this gene, this receptor will not be produced, it will not be expressed, it will not recognize the pathogen, so the pathogen can invade. So the problem with the genes or the problem with the environmental factors, one of the example we just gave about the antibiotic, they both can disturb this balance, and as a result Th17 or Th1 can take over. Once they take over, it's just going to cause damage. And one example is inflammatory bowel disease. There are two different variants of inflammatory bowel disease. Just to give you an example, one is called as ulcerative colitis, one is called as Crohn's disease. One has patchy lesions, one has continuous lesions, diarrhea, vomiting, pain, abdominal pain, fever, weight loss. All these are the clinical picture of such patients, but it starts here actually with a problem with this balance. Now just a small scenario, because we didn't too much talked about the Th2 component with respect to the mucosal immunity. So if a 35-year-old male who present to the emergency room with acute dysphagia, vomiting and abdominal pain, the symptoms began when he was having lunch at work. The skin prick test demonstrates a response to bananas. Skin prick test, what does it pick? Allergy. Immediate hypersensitivity, and so it's possibly a case of food allergy. Why do you think the patient mucosal immune system generates such response against banana? What was activated, you think? Yes, Th2. Th2 will activate what? IgE, mast cells, degranulation of histamine, and then whole set of features. How can understanding oral tolerance help us manage allergy? Do you think there was a problem with oral tolerance? Yes. Why not? There is a problem with the oral tolerance. That's why the patient have got allergy. Any questions? So basically, again, all the